Hi, everyone. We just held our fourth annual EGFR Resisters Research Summit this past week, November 17th and 18th in Chicago. In case you aren't familiar with the EGFR Resisters Research Summit, this is the fourth year that we've brought together young investigators from across North America who are doing work related to EGFR-positive lung cancer. Next slide, please. As in the past, we had a fantastic group of expert mentor judges who are the leaders in EGFR lung cancer, chaired by Dr. Zofia Piotrowska, to give feedback on the young investigator presentations. We also brought back this year 9 returning alums who have participated in one of our previous summits. These returning alums really added to this year's summit through the updates that they gave on their research and through some of them sharing mentoring moments on topics like transitioning from fellow to faculty and managing work-life balance. Next slide, please. This year, we were fortunate to have 10 young researchers as part of our new 2022 cohort from diverse locations across the country attend for the first time. In addition to getting experience in presenting their work at the summit, these researchers truly benefit from developing collaborative relationships between themselves and with the mentor judges. They also gain tremendous value from forming and strengthening connections with the summit alum because they're just maybe a year or two ahead of them on their career paths. And also with the patient advocates from the EGFR resistors who attended, since some of them have probably never worked with patient advocates previously. Next slide, please. Attending from the EGFR resistors this year were Jill Feldman, who attended the summit in person, myself, who attended virtually, and on the next slide, you'll also see a picture of Lindy Campbell, who is a patient advocate and patient living with EGFR-positive lung cancer, who has her own nonprofit called Breath of Hope Kentucky and works very, very closely with the EGFR resistors and considers herself a member of the resistors as well. We really hope, we, the EGFR resistors, really hope that creating these relationships and sense of community encourage our young investigators to continue their work in lung cancer, especially EGFR lung cancer. As you can see, this picture up on the screen is from our first summit in 2019, which we were able to hold in person. Then COVID hit. So for the next 2 years, you can see here's our 2020 summit, which we transitioned to a virtual format, which, you know, we tried to make as fun as possible. 2021 was the same with matching backgrounds and jackets and cups. And we were very happy this year in 2022 to be able to return to an in-person format for the first time in 2 years. There were just a lot of opportunities that don't necessarily exist with a virtual format for informal conversations and collaborative discussions, whether they were part of small table meetups or other casual conversations at meals and at breaks. Now I'm going to turn our video over to Dr. Stephen Liu, one of our mentor judges, who will talk about the fun mentoring moments we had this year and summarize some of the research that can be shared that was presented by the investigators attending the summit.
Thanks, Ivy. It really was a tremendous experience for everyone involved. And this really is where collaboration is born. This is how we move the field forward together. At this summit, we did have mentoring moments from some of the alumni and Jill as well. Dr. Josh Sabari from NYU talked about making that transition from a trainee into a faculty member, some advice for protecting your time and determining what's important for you as you go forward in your career, prioritizing academics, and really how to ensure you land on a successful path. I found this very helpful even for myself, and I know that our attendees did as well. Jill talked a bit about disrupting the paradigm in research, partnering with patients and what that means, the different types of advocacy and how that can make the research stronger and make the outcomes more meaningful and better in general. And Dr. Christine Besvina from the University of Chicago talked about how to balance career and family and some tips and tricks that she's learned along the way to make sure we have that balance to ensure a long, fruitful career. And all of these very helpful. And of course, the star was really talking about the new research and some of the projects proposed by the Young Investigators 2022. And so I'd like to briefly highlight each of these investigators and the tremendous work that they've done and show just how promising the future is. Dr. Bailey Fitzgerald from the Icahn School of Medicine at Mount Sinai in Manhattan talked about predictors of primary osimertinib resistance. And this was an early theme at the summit. We really are not satisfied where things are, where we're really not accepting the status quo. And while we know a drug like osimertinib, a third-generation EGFR kinase inhibitor, has very high response rates, the response rates are not 100%. So trying to understand why this drug doesn't work for everyone and how we can overcome that's very important. This work looked at patients who did not achieve an initial response, really trying to understand why. Related to that was some work presented by Dr. Fauzi Abu-Ras from Henry Ford Cancer Institute in Michigan, highlighting a case with an EGFR exon 19 deletion and an ERBB2 mutation, really how that can mediate primary resistance to osimertinib. And Dr. Paul Stockhammer, a resident at Yale, discussed how co-occurring alterations in multiple tumor suppressor genes, such as TP53, is associated with outcomes in patients with EGFR mutant lung cancer, highlighting the significant heterogeneity within EGFR mutant lung cancer. While this is one slice of the pie chart of actionable alterations, we've learned over time that these differences are critical and that the biology behind it, an EGFR deletion 19, is different from an EGFR L858R, but even within those, the specific mutations and the co-mutations are likely playing some role influencing the biology, and we're just scratching the surface and understanding how we can leverage those differences to maximize outcomes for patients. So important work being done highlighting the impact of these mutations on the biology and the course. Looking at different ways that EGFR affects lung cancer cells, we understand now that inhibition of EGFR induces aberrant cell cycle control and influences DNA damage and apoptosis. This was presented in some very elegant preclinical work from Dr. Rama Ali at Vanderbilt University. Really impactful, hoping that this leads to newer strategies. Related to that, Dr. Chetan Vikalagada from Northwestern University outlined a randomized phase 2 study that he has designed with the work of Jyoti Patel of olaparib in combination with osimertinib for patients with EGFR mutant lung cancer and germline mutations in the homologous recombination repair. Again, that heterogeneity and showing that there are differences within EGFR mutant lung cancer that we can perhaps leverage and really try to focus on further personalizing therapies. This trial in these stages of development, but hopefully will yield some very encouraging and interesting results. Certainly going to learn a lot from that, as well as a new strategy to understand the biology and identify new ways to attack EGFR mutant lung cancer. Dr. Mustafa El-Bawari at Albert Einstein College of Medicine in New York outlined a novel therapeutic monoclonal antibody that targets MARylation, or mono-ADP ribosylation, to increase sensitivity to osimertinib. And this could play a role in resensitizing or overcoming acquired resistance, but potentially in overcoming primary resistance, again, showing that all of these projects can ultimately be related to each other and intertwined. If we can identify patients who are unlikely to respond initially to osimertinib, perhaps a novel approach such as this one will be able to overcome that initial primary resistance. One of our fellows here at Georgetown University, Dr. Jennifer Marks, presented a case of synchronous EGFR mutations in a patient with Li-Fraumeni syndrome. And we know that Li-Fraumeni syndrome predisposes patients to the risk of lung cancer. There seems to be a relatively high rate of EGFR mutations within that subset. Understanding why may allow us to understand why these cancers develop in everybody. And certainly there are unique contextual clinical considerations in treating these situations. And so this was a very eye-opening case to all of us. And Dr. Monica Chen at Memorial Sloan Kettering Cancer Center discussed a phase 2 single-arm study of amivantamab, a bispecific antibody, plus lazertinib in EGFR mutant lung cancer with CNS metastases, outlining the unmet need in that setting, and how this strategy may be able to overcome some of those barriers to therapy. Our final presentation from our 2022 Young Investigators was from Dr. Eric Singy at MD Anderson Cancer Center, who talked about bridging the communication gap and showed a beautiful plain language summary of a pivotal clinical trial, in this case, the ADORA study for patients with lung cancer. When we look at these studies overall, I think these are some very important topics. Ivy, when we think of resistance, we're usually talking about acquired resistance, but I think it was refreshing to see some of the focus on primary or intrinsic resistance, right?
Yeah, that was really very interesting. Dr. Fitzgerald's presentation looking at that. I mean, there's frequently people who we see in our EGFR resistors group who may start a therapy and then within the first 3 months find out that it is not working. Of course, not as many as people who it works for, but it does happen. So just knowing that there is some research going on looking at that is really incredibly important and meeting an unmet need of our membership.
Yeah, I agree. Challenging the status quo, not settling for those high response rates because they're not as high as we want them to be. And Jill, I think this last topic here from Dr. Singy about the communication gap, communication is really essential to partnering with patients. And not all of our patients have the PRA training, for example, understand how trials are conducted. I know you were involved in this project. I think this is pretty meaningful work, don't you?
Yeah, I do think it's very meaningful work. And, when a patient is first diagnosed, they want to talk to their doctor about how other people like them have experienced a certain treatment or why they chose that treatment. And there are some plain language summaries out there of pivotal research that, provides data to make these decisions. But that's really for people at my and Ivy and Lindy's level. There's nothing for people who are, just hearing these words and phrases for the first time. So this is both to help patients, but also to help clinicians and nurses as an aid to talk to their patients. And so I'm really excited about this project and looking forward to getting more patients involved to help.
All of these have the potential to really make an impact at the individual patient level and sort of more globally increasing our understanding, our ability to better treat these cancers. And so this really was an impressive summit talking about some new projects. And we know from past experience, Jill and Ivy, that these projects really can lead to pretty big things. One of the nice things about this particular summit that you'd arranged was having some of the alumni come and give progress reports on the work that they've done. And we heard from one of my colleagues here at Georgetown, Dr. Joshua Royce, who gave an update on a phase 2 study he has of tiragolumab, an anti-TIGIT antibody, with atezolizumab and bevacizumab, a chemotherapy-free immunotherapy-based regimen for patients with IO-naive but TKI refractory EGFR mutant lung cancer. And we know that immunotherapy is disappointing in EGFR mutant lung cancer, but it doesn't have to be the case. And there are a lot of efforts to really try to understand why it doesn't work well for everyone and how we can make it work. And this is one of those important studies. I think this is a great example where this received sort of an honorable mention award at the EGFR Resisters Summit. Dr. Royce took that, moved forward with the study, and was able to receive a longevity career development award. I think this sort of speaks to some of the impact that this summit has, not just in the field, but also the investigators involved. Julia Rotow from Dana-Farber Cancer Institute gave an update for work she's been doing with osimertinib and selpercatinib for EGFR mutant lung cancer harboring an acquired RET fusion. This was already presented at a global meeting, and this work is ongoing and has proven to be very successful, very important work. Nicole Yoon, who presented initially as a resident and now in her fellowship, gave an update on RNA sequencing to better characterize pathways in EGFR mutant lung cancer, influencing future strategies to overcome resistance. And Dr. Catherine Mador from Massachusetts General Hospital, now on faculty, talked about EGFR mutant lung cancer with squamous histology and how that influences outcomes and maybe resistance. These different histologies are important for both intrinsic and acquired resistance. Dr. Joseph Chan, who's one of the grand winners in an earlier summit, gave an update on lineage plasticity at the single cell level, really helping influence our understanding of small cell transformation and how important that is in small cell lung in EGFR mutant lung cancer. So tremendous presentation here. And our winner last year, Dr. Elaine Shum, gave an update on the lung cancer screening in female Asian non-smokers. Screening playing an important role for patients with a strong smoking history, but we know that lung cancer can influence people who have never smoked, and we don't have great screening tools in that population. This is an incredibly important effort, really mirroring some of the work that has been done in Taiwan, exploring screening in an otherwise high-risk population. Eagerly awaiting some public updates on the outcomes in this study, but great to see the progress she's made so far. And so these were all wonderful presentations. We learned quite a bit, and as with every competition, there were awards to be given. Ivy, do you want to tell us who received the awards at this year's EGFR Resisters Research Summit?
So this is always a very exciting finale to the research summit. At the end of the summit, we give awards to a few of the participants who we feel have gone a little bit above and beyond in their presentations. These aren't huge awards, they're small monetary awards to the institutions of the presenters, but the point of them is to show that we are excited about the work and to hopefully lead to a little bit of attention and excitement for the young investigators' work in general, with the goal of possibly leading to future awards. So this year, we were happy to present the Notable Alumni Award to Dr. Joshua Sabari for his participation in the summit, which was really fantastic and incredibly helpful to the young investigators. And from the young investigators of our 2022 class, we presented the first runner-up award to Dr. Chetan Vakalagada from Northwestern University for his very exciting, groundbreaking trial that he's looking at. And we presented the grand prize award for Distinguished Young Investigator to Dr. Paul Stockhammer from Yale. And one thing I want to point out about Dr. Stockhammer is that he actually is very early in his career. He's a resident and he won our top award. So we were very excited to have him participating in our summit and be part of the class of 2022.
And Josh Sabari participated in our very first inaugural EGFR Research Summit in 2019. And his work was so important, and he played a critical role in the approval of amivantamab. So it was really exciting to see that happen. But really, prior to the summit also, we wanted to understand the value of the EGFR Resisters Research Summit. So in collaboration with CEC Oncology, we presented a poster at ASCO this year that looked at the direct impact that this research summit had on improving competence, performance, and professional productivity in the young investigators. And when we looked through the results, it really showed that a research forum designed for young investigators can improve performance and confidence, as well as professional productivity that is so essential for their career path, with some going on as well to obtain NIH or other major grants. which is no small feat. It also showed an increased incorporation of the patient perspective in clinical trials, which is very important to us. And the attendees continue to be involved with mentors and colleagues that they met at this summit. So to see that also there were some published data was exciting, because that also isn't very easy. We think that those are highlights that really highlight the significant impact that this summit has on advancing professional development of the next generation of lung cancer researchers. Next slide. The summit is also designed to be an intimate setting where young investigators have various and many opportunities to interact with each other. And I just have to say, to witness the passion and excitement of the young investigators transpire over the couple of days was one of the most inspiring things that I've seen. Their eagerness to network, discuss their work, talk about collaborative efforts, and to see them feel more comfortable as the day went on was so gratifying. And the unwavering support from our mentor judges in supporting these young investigators was so genuine. So it was really such a wonderful summit. And I think another important part of it is seeing them make new friends. That is also critical as their careers evolve, as some of our alumni talked about in their mentoring moments. There is no other setting that offers a safe place for these young investigators to get constructive feedback from key opinion leaders, to have intimate conversation, ask intimate and hard questions, get career advice, and be able to talk and learn to patient advocates. So we really want to thank our mentor judges, especially for their unwavering support for our community and always stepping up to help in any way that they can. We are so grateful for all of them. We are grateful for AstraZeneca giving us an independent educational grant for this event. We wouldn't be able to do it without them. And of course, we want to thank CC Oncology, Joni and team, for your creativity, your tireless efforts, and the amount of energy that you put into making this a successful event. We thank you from the bottom of our hearts. And I'll just end by saying hope is a word that I never used to associate with lung cancer. But the true value of the EGFR Resisters Research Summit is watching the future of lung cancer research and care evolve for the better. And the future is bright, and that is what gives us hope. Thank you.
And so congratulations to all the young investigators, and thank you, Jill and Ivy, for all the work that you've done. It really is such a meaningful summit, and we're so glad to welcome more people into this club, and together really working to move progress forward. It's so impressive to see how much progress has really come directly from this summit. It really is, sort of shows what can be accomplished.
Thank you, and thank you.
Thank you.